Black Doctors podcast highlights the stories of minority professionals with the goal of inspiring others. Season 2 provides more episodes and features a wider variety of professions. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to the Black Doctors podcast. I'm Stephen, your host. I'm privileged to be speaking this week with Dr. Derecka Alexander. She is a Doctor of Veterinary Medicine, and we're going to learn about all things animal related. Dr. Alexander, welcome to the show.
Hi, thanks for having me. I really appreciate it.
I've been so excited to speak with you and learn about this field that I know absolutely nothing about. So can you just start with telling us about yourself and who you are and how you came to be a veterinarian?
Okay, so, Dr. Derecka Alexander. Everyone calls me Dr. Alexander. And I'm from Kenner, Louisiana. It's a part of the greater New Orleans area. So who dat, go Saints. And I currently reside in Las Vegas, Nevada, where I practice as a small animal general practitioner.
So what's a typical day like for you?
So a typical day for me is getting to work between 7 and 8 a.m. If it's my surgery day, then I'm there checking in my patients, trying to make sure the surgeries are getting checked in properly, make sure that we have the proper lab work in order, or make sure we're getting the lab work, trying to prep surgeries as well, helping my staff. Usually start seeing rooms right away if I don't have any surgeries. Usually praying and hoping that I don't start my morning off with an emergency. Sometimes that happens. So during the day, I see different types of cases and they vary from routine vaccine rooms to rooms where the patient's coming in having some vomiting and or diarrhea, even to quality of life talks. Sometimes people come in there like, my dog is walking in circles. And I'm like, okay, that's not normal. So let's figure this out. Or sometimes they're in and they're like, my dog coughed once this month. And I'm like, okay, well, let's figure this out. So, they can't tell us, our furry animal pets can't tell us what's going on. And I'm just there to help bridge the human-animal bond and help owners figure out what's going on with their pets so they can get back to having them healthy and happy at home with them.
That's so cool. So in a 5-day work week, you have some OR days and some clinic days. Is that how it's set up?
Yes. Right now, the practice that I'm at right now, we have 4 to 5 doctors. So right now we kind of split it up to each of us having 1 surgery day, or 1 to 2 surgery days a week. And then we split that up amongst us. And sometimes I'll have something I might turn into a surgery. Like if I have a patient that comes in for vomiting and or diarrhea, and I do some x-rays, and the x-rays come back showing that there's a suspect foreign body. And I think there's a foreign body, then I'm prepping to do a surgery that day. Or if I have an emergency surgery like a pyometra, which is when the uterus of a female dog or a cat is infected and I have to go in and take it out as soon as possible, then it turns into an emergency. That's an emergency surgery that I need to try to fit into my schedule. Not every veterinary practice is set up this way. It's just how ours is set up out here in Las Vegas.
So at your practice, you have clinic space and operating theater?
Yes, I have a surgery suite. We have our treatment room where everything happens. That's where everything goes down. I have the radiology area. That's where we take x-rays and where ultrasounds can be performed. We have some wet tables where we do certain procedures like dental cleanings. And if a tooth or teeth need to be extracted, then we do that at those tables. We also have an endoscopy. We have endoscopy at my clinic. I'm not certified in that, or I didn't go to any special continuing educations for that. My manager did, so she's the one in charge of all that for the endoscopy, which is pretty cool. Kind of cool to see that.
So I'm an anesthesiologist, so I have to ask, how does that part of surgery work?
Well, we begin with pre-medding the patient according to the blood work, and if we think that patient's a good anesthetic candidate, I just kind of generally make sure that they, on physical exam, that they are clear. I don't feel any enlarged lymph nodes. The heart and lungs auscultate within normal limits. course, we try to do pre-op blood work with everything. We don't like pretty much every surgery has some kind of pre-op blood work. I definitely want to see those liver and kidney values. I want to know what red blood cells, white blood cells, the platelet counts is like. And from there, there are a few drugs we can choose to pre-med with. Yeah, just kind of, we pre-med them, we induce them, intubate them, and get it going from there. They've got to shave and make sure we have some good surgery margins for whatever procedure it is. Sometimes I have to warn owners about that because then they get a little fluffy back, and fluffy may not be fluffy in certain areas. And they're like, what happened? I'm like, dude, I got to shave it.
Right.
Hair is dirty, it gets in the field, it causes more infection, and I'm trying to stop that. And so, like, 99% of people understand. They don't care. There's a few people who are like, hey, wait, don't shave so much. Don't make any promises, though. I like wide surgery margins. The hair I hate if hair gets in my way. I'm like, annoyed while trying to tie off a pedicle or something. We don't have like an anesthesiologist on staff. So basically, I'm like an anesthesiologist. It's me and my veterinary nurse. And then I also have veterinary assistants that are trained in monitoring anesthesia. So before the surgery starts, I'm like going over the protocol with my nurse or assistant. And once I'm in surgery, if something's going on, they're constantly communicating with me. And then there are times when I'm like just communicating with them. I'm like, hey, how's the patient doing? What's going on? Like, let's communicate just in case someone's just like writing down numbers and it might be someone who's new. They might be afraid to say something. I'm like, no, it's okay. Let's communicate. Let's make sure we're always like talk about what's going on like every so often. So, and then after the procedure's done, my nurses are the ones that usually extubate and make sure they're recovering fine, make sure they don't need, or if they do need a heating source, then making sure that the temperature is constantly being checked, or if they don't need it, then we're taking it away and making sure that we have medical collars, those e-collars, the big cone of chain that has to go on everyone because we don't want them waking up and then starting to look at their incision or whatever they had done. So as far as I know in human medicine, like there's an anesthesiologist at everything for everything, but in veterinary medicine, a vet kind of like serves as like every doctor, at least in a GP practice, like in general, as a general practitioner. And that's what I am. But there are specialties within the profession. So there are veterinarians who are anesthesiologists, and they sometimes if I don't feel comfortable putting a patient under anesthesia due to comorbidities or they have like some kind of cardiac issue, I try to refer them to a specialist or to the specialty center where they can work with a surgeon and an anesthesiologist at the same time so that more can be done for that patient. Because as a GP, I only have certain things on the shelf at my clinic, whereas at the specialty centers, they have a plethora of things, and they just have more tools in their toolbox to work with for patients that have comorbidities and stuff like that.
You're a one-woman show at your clinic.
Yeah. Sometimes I'm like, woohoo. And then sometimes I'm like, well, most of the time I'm like, oh my God, I'm so stressed. This is hard. And then, we just work together as a team and get it done. I've always had great mentors out here in Las Vegas. So that's one of the reasons why I came out here. I heard about the mentorship, how good it is. And we're always helping each other and learning new things and making sure that we're doing the best we can for our patients.
So cool. So most of your patients are like cats and dogs, or
most of my
what else?
So most of my patients are cats and dogs. There are other veterinarians that do more of like a mixed practice, or they'll see pocket pets, exotics. My managing doctor does not like snakes, so we will never have a snake in the clinic while she's there, at least. But I do cats and dogs. Sometimes I like to call myself a pediatric veterinarian. I'll do kittens and puppies. Those are the fun ones.
Oh.
When they're not sick, when they're just there to get their routine checkup, it's fun. But there are some veterinarians that like to go down the route of equine medicine. So they're working on horses day to day. Some veterinarians like to stick with large animal only, and they're working with cattle, the bovine, cows, bulls. And there are different specialties where people will see a plethora of a range of animals I just stick to dogs and cats because that's what I like and that's what I'm going to do.
Yeah. So with the different specialties, like what other types of subspecialties are there?
Like many. So there's anesthesia. There's also animal welfare. There's equine medicine. So animal welfare and shelter med, I kind of put them with the same, but it's the same thing. In shelter medicine, you're mostly concerned about the population of the animals. But yeah, there's a lot of different things. There's ophthalmology. So there are veterinarians who focus on the eyes for all species. Nutrition, internal medicine, and with internal medicine, there are a subspecialty, if you want to call it that. There's cardiology, neurology, oncology.
Oh, wow.
There's emergency and critical care. There's dermatology, and it's so funny. Sometimes I see a lot of derm cases out here in Las Vegas, and sometimes I have to consult or just straight up refer a patient to one of the dermatologists, and sometimes I'll have clients, they're like a dermatologist, so I have to make an appointment with. I'm like, no. There's a veterinarian, someone who went to school for 4 years like me, and then they went to school longer and decided to specialize in the skin. And it's not just like specializing in the skin; they learn a lot about the immune system to figure out like why the skin is reacting that way and what else could be going on and what kind of medications will work for that patient. So I'm like, there's a veterinarian who's a dermatologist, and there's so much. There's pathology. It's the same like in human medicine. Majority of the specialties in human medicine you can find in veterinary medicine, but we definitely don't have as many. Emergency critical care. There's laboratory animal medicine. I know quite a few people who go into that. See, what else am I leaving out? Pharmacology. It's not like we have a pharmacologist at like a hospital. They mostly like work with drug companies and do research and help people like me figure out how to practice good veterinary medicine. There's radiology. They're great because they help people like me interpret the little things on the radiographs. I mean, the first time I took a radiology class, I was like, oh my gosh, it's just gray. I was like, I don't know what I'm looking at. Like it's
right.
Black, white, gray. And but they're really good at picking up those patterns and helping people like me diagnose patients properly. And then there's also therio. So theriogenology, I consider them like the OBGYNs of veterinary medicine. They deal with a lot of reproductive veterinary medicine, large animal, farm animals, equine, aquatics. That's who work at zoos mostly. And then there's also people who do integrative medicine. So we have veterinarians that do the acupuncture or traditional Chinese medicine certifications, and they learn to integrate that into their practice to help their patients.
Wow.
Within that, sports rehab or rehabilitation in general. And there's also surgery. You have the surgeons that focus on orthopedics and surgeons that focus on soft tissue. So when I get cases where they have multiple bony issues going on, like the hips look bad, the knees look bad, it's just all bad. I'm like, okay, you need to go see one of the surgeons so they can give you the proper treatment plan moving forward, because it's not good to try to correct all these things surgically at one time. Sometimes it's not. I just tell them to go to the surgeon so that they can be properly informed.
That is incredibly robust. I guess I've never fully thought about it, but yeah, veterinary medicine has all these subspecialties.
Yeah, pretty much. It's kind of cool. The thing about the specialties is, so like I'm a GP. I went to school for 4 years, and I chose not to do any kind of internship or residency. I decided to go straight into practice. The veterinarians who want to do one of these specialties, most of the time they have to do a rotating internship. So they rotate through different departments within like a veterinary school or like a big specialty center.
Okay.
They're in internal med, in surgery, in derm, in radiology, rotating through. So kind of sort of being like a GP, but on a different level. And from there, they apply for residency. And once they get that, they're dedicating like 3 to 4 years to anesthesiology or to equine surgery or ophthalmology, dermatology, one of those specialties.
So for you, Dr. Alexander, when did you decide that you wanted to be a veterinarian?
So, I mean, growing up, I was told to like try to be a doctor or a lawyer, which I was like, okay, I guess. And I always liked medicine, I always liked science. And then I was like, well, I really like animals. I used to always watch some kind of little animal documentary on like the Discovery Channel or something like that. And as I got a little bit older and I saw like an announcement for volunteers being needed at the zoo and the aquarium. So I started volunteering at the aquarium in New Orleans. And that was like my first real experience with animals and working with them and talking to the public about them. So I was like, I don't know, 12, 13 doing that. Did that for a little while. Like in high school, read about trying to be a veterinarian. I was like, wow, this is going to be hard. Okay, I'm up for the challenge. Let's do it. And got my first job at a veterinary practice when I was like 17. It was pretty busy. There's a lot going on. I'll never forget, like that day, there was a cat that was blocked. So sometimes cats, usually it's a male cat, if they go through a period of like 24 hours of not really urinating, they become that means they're a blocked cat. They can't urinate. They have a very inflamed urethra, lower urinary tract. Sometimes might be stones, or sometimes it's just really inflamed tissue down there. And I was watching a veterinarian trying to unblock the cat, and it was kind of gross.
Okay.
I was just like, okay. There were like weird smells everywhere. Everyone, like, I wouldn't say they were running around, but people were just busy doing their jobs.
And that made you want to do
I was just
vet medicine.
I thought it was gross, and they were like, "Do you still want to work here?" Because it was kind of like they knew I was young, and they were like, "Oh, young, like teenagers come in, and now they say they want to be a vet. They do this for a day, then they don't. Then they're like, "Oh, this is gross. I don't want to do this." And I was like, "No, I do." And then after that, I was just like, "Okay, I said I was going to do this, so now I really got to do this." And just like tried to learn along the way, like different things about veterinary medicine. So so it helped me get into vet school. And once I got to vet school, I was like, okay, I guess I'm here.
Cool. So where'd you go to college?
For college, I went to Louisiana State University in Baton Rouge. Go Tigers! I did that for like 4 years. I ended up double majoring because, so like for veterinary medicine, you can most people will do, or some people will do just straight up biology or biological sciences because it helps fulfill most of your prereqs for professional school of veterinary medicine. Or if you want to switch it up and do something else, then you can apply to dentistry or dental school or medical school if you decide to change. But some colleges, usually your agriculture colleges like LSU's and A&M, Texas A&M, colleges that have like a focus, more of a focus on agriculture, they'll have certain majors like animal science or dairy science or some kind of like animal and science. And so I started taking those classes along with biology, and I realized I could fulfill both at the same time. So I was like, well, let me just do both. That way I can learn some things about animals that I didn't know about, and also pick up other classes and have like a stronger science background to be ready for vet school for whenever I, go. And what's cool about the animal science classes is that I didn't grow up on a farm or in a rural area. I'm a city girl and I like the city. But like there are quite a few people in the profession who did grow up in like a rural area or semi-rural area. Their grandparents had a farm or something like that, and so they came in contact with large animals, cows, bulls, horses, goats, chickens. So they had more contact with those kind of animals and more comfortable about them, with them, knew some things about them. Because I mean, if you're going to have a farm, you have to know about your animals, how to take care of them, husbandry, and that kind of stuff. And so, since I didn't grow up like learning that in college, that's when I started learning a lot more about that. and I found it fascinating. I ended up doing a little bit of research at the dairy farm at LSU when it was there. So that was interesting. So from there, I took like a year and a half off after I was done with college because I was like very done with school at that time. And from there, I decided to do a public health degree. So I went to the LSU School of Health and Sciences. I went there to get a master's in public health, and that was like so much fun. I really enjoyed that program, and from going from there to vet school, my focus was to try to be a public health veterinarian, and that's also like a specialty within veterinary medicine. So there's some. There are a good amount of vets that work within the public health sector or the government sector. Some vets work in policy, and they're at the USDA working on like trade, food, animal stuff. Some vets work in the Department of Homeland Security, working with some of them work with dogs and horses with that, and some of them just work on like science policy. Other vets that work within public health they're either like a state vet or working right under the state veterinarian, trying to track and control and perform surveillance on disease and outbreaks in animals. I'm more so like a dog and cat within the dog and cat part of the veterinary medicine, but the public health vets, they also work with farmers and I guess mainly farmers, and other people within the state when it comes to managing and controlling and performing surveillance on certain diseases, like rabies.
Wow.
We don't really see a lot of rabies cases like how they used to back in the day, but public health vets will perform surveillance on that, making sure it's under control. Most of the time, rabies is like being contracted like through a bat or exposure to a bat, but we have laws in place to make sure it's controlled within our pet populations, and so they'll work with that. And I'm trying to think of what else. This is all stuff that I was like really into, and
Yeah.
I still am into it. It's just I was super hyper focused on it when I first started vet school. So I just had like a list of things I was going to do, and probably like 6 or 8 months before graduation, I decided to switch it up and do general practice for a little while, which was hard for me because I didn't focus on small animal. I focused on trying to do public health. And at the very last minute, I switched it up, and I was just like, okay, now I have a lot to learn before I graduate. And even after I graduated, I would like go home and try to like figure out what I was like not doing or what I thought I wasn't doing right, or trying to just read up on things so I can like just have a better recall of it.
So, Dr. Alexander, how was the application process to vet school? And then can you just tell us kind of what veterinarian medicine school is like?
So for the application process, I applied through an application called the VMCAS. It's an online application that you go through, and you kind of pick which schools you want to send your application to and make sure you fulfill their prerequisites. For the most part, they all require the same things. Some want a little bit more. So when I was in undergrad, I was thinking about, I wanted to keep my options open. So besides LSU being on my list of schools I would like to go to, there were other schools that I thought would be a good fit for me. And that's another reason why I decided to do biological sciences, because it allowed me to fulfill the prerequisites for other schools that LSU, classes that LSU didn't require. So it's a long application that opens up in the beginning of the summer, and you just kind of have to just get it done. One of the most important things I think that I did before I applied was I kept a log of every animal experience I ever had since like I was 13.
Wow.
And I was doing this since high school. When I was applying to colleges, I had a mentor who asked me about having a CV or something like that. And I was like, what's that? And I know what it is now, but like back then I was like, I don't know what that is. I don't. And he was just like trying to, I guess, like, groom me and get me ready for my applications. And ever since then, I just always kept that CV and would add things to it, take things off, and make sure I kept a logbook of it. And while I was in undergrad, I was a part of the pre-veterinary club at LSU. So for anyone who's interested in veterinary medicine, definitely try to get into one of those clubs, because there are people who can really help you make sure that you're doing the right thing along the way. And with them, whenever applications came up, they always had like a meeting or two dedicated to that. So I just took note, and that was one of the things. Make sure you write down all of your animal experiences and how many hours, when it happened, who it was with. That was probably the longest part of me putting my application together, along with my essay, like letter of interest of why I wanted to go to vet school, and my letter of recommendations. I think they required like 3, and I always try to like have more than that, unless it's an application that says do not send more than 3. Like, we only want 3. But I always ask for more, because sometimes things happen and someone may not get it in. That happened to me one time on a different application, so I don't play with that anymore. That's usually due somewhere between the end of September and early October. Once that's done, it gets sent to the schools. And from there, they start grading the applications, ranking them, trying to figure out who should get an interview. For me, everyone interviewed when I was applying. I think now LSU does early admissions, where if they think you're a good fit for the program, they will accept you early without an interview, I believe. But I know back when I applied, everyone got I wouldn't say everyone. Most Louisiana residents got an interview, and definitely the out-of-state students who were applying who were a good fit who they thought were a good fit for the school, they got an interview. And so the next step after the application is you wait for your email that says you're going to get an interview. You go for your interview, trying to make yourself shine, talk about yourself, your animal experiences. And I remember when I had my interview, I research every question that could possibly be asked. They're usually on some blog posts out there on the internet. And I tried to pre-answer the questions so that I could just be prepared. Ask people who were like a year or two above me already in vet school how the interview went, what they recommended. I always stress mentorship to people, especially in veterinary medicine, because some things that aren't out on the internet. There are students now, or people who are about to graduate. They created YouTube channels to better help those who are trying to get into vet school or who are trying to follow their steps. And I think that's great. I don't have one, but if people reach out to me, I can easily just point them in the right direction and tell them what I did. And there's one student. She was in undergrad when I met her. I straight up gave her my whole application. I was like, here's a copy of my application that I did, and I had it printed out. I had it ready. I was like, I had all those questions that I answered. I have them all together, and I just put it in a folder, and I was like, this is everything. This will help you. And let me know if you have any more questions. So I definitely do that for everyone. I can help. I know how to help people get in, and I don't mind doing that because people help me. So, and it's. Oh, I would say vet school is not the easiest to get into. There are more vet schools now than when I applied. There's just a couple more, but there's still less than 35. I think now there's 32 in the U.S.
Wow.
Or 32 that are accredited. And there's a couple that got added on, but way less than a number of medical schools. So when I was trying to go to vet school, all I heard was how hard it was to get in. It's super hard to get in because there's not many of them. There's not even one vet school in every state in the country. So you're competing with a lot of people for a spot in a class of, at the time I applied, we were less than 80, but now I think they're most vet schools have 100 spots now. So a little bit
Okay.
more than they used to be, but still not a lot. Like in Louisiana, it's just LSU, and we have a contract with Arkansas, so 9 spots are for Arkansas students. 2 spots, I want to say 2 spots are for students from Puerto Rico, and so that's like 11 spots right there. That's not guaranteed to a person from Louisiana
Wow.
or out of state.
Jeez. So when you get in, it's a 4-year program.
Hmm.
So how is that program set up and structured?
They're all structured a little differently, just a little bit. Usually, you start off with your didactics in the first year or two. Sometimes, or some schools have been trying to incorporate more hands-on learning, like within the second or very beginning of the third year. When I was in vet school, it was classwork. Um, First year, second year, third year, a little bit more hands-on stuff. Our clinics didn't really start until halfway through third year. I'm sorry if you hear barking in the background. That's my roommate's dogs. They're kind of
Oh
doing
no,
a
it
lot.
sets the tone.
They're doing a lot right now. And I'm
If
like,
we
who
didn't
is
hear animals,
outside?
like, yeah, are you even a
Yes.
real vet?
Yes, I'm more of like a one animal person. I started off like just doing classwork in the beginning, starting at 8 a.m. to like 5 p.m. every day. And the first year was like anatomy lab. So it's like class all day, anatomy lab all night. And then I know in human medicine, you have to know about the human body. Like that's like this one structure, one species. And in veterinary medicine, depending on how the anatomy class is set up, schools vary from anatomy. One school to the another, their anatomy departments vary, but for the most part, you got to know about dogs, you got to know about the cats, you got to know about your bovine, bull, cow, and you got to know your equine anatomy.
Mm-hmm.
And then in between there's like something about sheep, something about goats, something about a rat, because you need to know that. So you need to know about a bird. Birds are kind of simple, so no one really stressed. Like in my opinion, their anatomy is simple. But dogs and cats, that wasn't. It was bad, but it wasn't too bad. Then when we got to like the large animal, I was just like, oh gosh, like we're in there just trying to, dissect a horse, and that's not easy. I'm trying to get through all those layers, find the right vessel you need to trace, and go from there. So that first year was long and tough. Second year, more classes, more tests, average of 2 tests a week. You just push through until the end, and you're like, yeah, I'm done. And then you start up again a few weeks later and push through to the end. Third year was a little less stressful just because you're there, you're used to it. You're like, okay, this is it. This is what it is. And so you just do what you need to do, and then you get to clinics, and that's a different kind of learning curve. So you're there, and now you need to apply everything you learned from like year 1 to year 3.5. And some schools will track. Some schools kind of push people to focus on small animal or large animal and take those rotations. At LSU, I was able to pick a special track. My track was public practice, so I wasn't on clinics a lot, maybe like half the time. Like I was on clinics, and I would leave and go do an externship, like with a veterinarian who was focusing on food policy, and then I would come back and have to do clinicals, and then I would leave again and go do another externship. So um, so my veterinary experience was, or my clinical year experience is very different than your traditional veterinary student, just because I didn't focus on animals. I kind of focused on public health and policy
Yeah.
and trying to figure that out until the very end. Then I was like, okay, let me focus on animals before I graduate.
Oh, that's awesome. So what would you say to students that are considering becoming veterinarians?
What I would say to them is to, like, I always tell students, or I try to tell students, to write down their why. Like, why do you want to be a veterinarian? Seeing that you love animals, that's cool, that's great, but like, it's the profession's so much more than that. And you kind of need to like dig a lot deeper to like stay the course and stick it out. I love animals, but there are times when I'm always seeing an animal in some kind of pain and suffering. And if that's not something that sits right with you, then you kind of have to like dig a little bit deeper. Or, I mean, some people kind of just choose to do research, and that's fine. Like, I love people who do research. They help me figure out how to practice, they help me know what I need to know to tell my clients. Um, but figure out your why and then seek out experiences with people who are working with animals. So I was lucky enough to get a job at a veterinary practice when I was in high school for a little while. And I got that job through a teacher who was like, oh, go check out this vet and see if he's hiring. Because if you want to be a vet, you should go work at a vet clinic. Like, it's very like important to seek out those experiences so that you understand the profession and get a little taste of medicine, and it just helps things stick along the way. And it also helps you with reminding you why you want to do what you want to do, seeing someone um, working in that job every day. So I just thought it was super cool to see the doctors like heal animals that can't talk and can't tell them where the pain is.
Yeah.
And so that's like number one. And don't stop with like the first person. Someone may tell you no. I've been told many times, and then I just move on to the next person or the next job, the next offer. And there are times where I just have to volunteer, and I was like working for free. I
Wow.
did that a lot. There are people who kind of just take advantage of the young vet or pre-vet student who really, really wants to get into vet school and will do almost anything to get in, and that includes working for free. So I did that, and it was what it was. I still value and cherish those experiences. And what else did I do? I always encourage people to do a little bit of research as well. I think it's stressed a little bit more nowadays for students who are applying to veterinary schools. Back when I was applying, it wasn't stressed too much, but I like research. I thought it was cool. And it gave me the opportunity to be at the dairy farm working with bull calves or just the dairy calves in general. And I would have never gotten that experience if I wouldn't have went into research or did a research program at LSU that offered that opportunity for me. Because I didn't grow up on a farm. I said that before. So that gave me that kind of experience. So if it's something that, you can't get like while you're in high school or something like that, once you get to college, there's more that's out there that you're able to get involved with. I also volunteered at a local animal shelter when I was in college for a while. And that's something I didn't care about getting paid for. That was fun.
So, as we start to wrap up, what are some things that you really want the humans you interact with as they bring their pets in? What do you want them to know about dealing with a vet?
Like, we have compassion. Veterinarians are very compassionate, to the point where a lot of people experience compassion fatigue. And some people get kind of down when we come in with an estimate and start going over the price of everything. In human medicine, you don't always see the bill. You're at the doctor, they tell you what you want to do. You're like, yes, yes, yes. Okay, fine. And then later on, like your insurance, they pay their side. And then if you have insurance, or you're stuck with the bill and you pay your bill. In veterinary medicine, not every pet has pet insurance. There is pet insurance out there for pets, but like, I don't know, maybe like a third of the client or patients I see have it. So that means if if Fluffy comes in for vomiting and having some diarrhea and I need to run blood work and x-rays, like at a minimum, they're going to spend $500. And sometimes like it sucks. Like I don't always want to talk about the price, especially right now during a pandemic where people's jobs are just like on the line, or they just don't know if they're going to still have their job in 2 weeks or 3 weeks. But it's just a part of
you
the
got to have
workout.
your job in 2 to 3 weeks. So
yeah, it's not even like, oh, I need to like pay the bills around here. I'm like, it costs money to run labs. It costs money to take an X-ray. They're more like a family member these days than they were back in the day. People didn't always think of their dog or cat as a living creature that needs to see a doctor every year at the minimum. But they should come see us. They should get their teeth professionally cleaned at our clinics every year. They should be getting their teeth brushed. They're living creatures that need to be cared for. And while I may come in talking about the price, just know that I'm always advocating for the pet. So
yeah. Well, let me say you have expanded my knowledge of veterinary medicine like 1,000% just in the last hour.
I feel like I just only scratched the surface. I'm like, there's so much more. I need to say this, I need to say that. And I'm like, wait, I don't want to get off track. I don't want to like start rambling.
Where can people get a hold of you or find you if they have questions about veterinary medicine?
I'm on LinkedIn. I don't check it that often, like at least not right now. But I'm on Instagram. If anyone hits me up on Instagram, I'll respond. Like I'm always available to help. I'm on Instagram at Dr._Derecka, Derecka. Yep, that's me. And if anyone has any other questions, they can definitely hit me up.
Well, thanks again for joining us on the Black Doctors podcast. I know our listeners have benefited greatly from the things you've shared.
The Black Doctors podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.